Let's now take a closer look at some of the numbers in the Senate bill and how that legislation could affect your coverage, because we're talking about this Senate health care bill. It faces opposition after a Congressional Budget Office report. We now know that at least 6 GOP senators now oppose the bill. Right now, there's not enough support to bring it to a vote. There was this nonpartisan CBO estimate that 22 million fewer people will have insurance in 2026 under the Senate bill compared with the new law.
And the new estimate also expects that the bill would cut the deficit by $321 billion over the next decade. And under Obamacare, a 21-year-old earning about $57,000 a year would pay $5,100 for a silver plan. A 64-year-old with the same income would pay $6,800. Tax credits cover part of that cost.
The Senate plan would reduce the 21-year-old premiums, but the 64-year-old would pay more than $20,000. The older person would receive no tax credit and could be charged up to 5 times more than a younger person. The White House says the CBO cannot accurately predict how health care legislation will impact insurance coverage.
Let's now take a closer look at those Senate numbers in the Senate bill and how the legislation could affect your coverage. Shannon Pettypiece, White House correspondent for Bloomberg News, is with us from Washington. Good morning. So just after sharing with our viewers those numbers, I mean, what factors into how much someone pays for health care?
Two of the big factors are the subsidies and how much insurers can charge people who are older. As those charts illustrated really well, insurers can now charge older people more for insurance. So a 64-year-old, someone in their 50s or 60s, can now pay as much as 5 times a healthy person. So you see their costs go up. And at the same time, the subsidies for people who are sort of upper, lower, middle income go down. So they don't get as much of a subsidy and a tax credit. And so that's what has these sort of older, lower income Americans feeling really bearing the biggest brunt of these changes.
Why the tax benefits for wealthy people?
The fits in with larger Republican ideology of cutting tax credits, believing that fewer taxes is going to be better for economic growth. One of the key principles driving Republicans' desire to repeal and replace Obamacare is to get rid of these taxes as part of this bigger ideology of a low-tax economy.
Now, the largest savings come from reductions in the Medicaid spending. And as you know, nearly 70 million Americans really rely on Medicaid. So what does this mean for them, Shannon?
Eventually, millions of people will lose Medicaid coverage, according to the CBO estimate. The expansion will eventually be rolled back. It'll be harder in the future to qualify for Medicaid, and hospitals and nursing homes and institutions that depend on those Medicaid payments will eventually see cuts as this bill reduces really how much money is given to state and how quickly the money given to states can grow.
One of the things that Obamacare did was required coverage of essential benefits: birth control, maternity care, vaccines, mental health. This bill does not. So how would this affect coverage?
Well, that's an excellent point. So now insurers do not have to provide these sort of basic services, even doctor's visits, prescription drug coverage, which they didn't have to do before this law. So if you have an employee plan, you don't think this affects you, well, now your employer could provide you a really skinny basic plan that maybe doesn't even cover doctor's visits or prescription drug coverage or mental health or maternity care or vaccines. So all those things, even people who think I have coverage from my employer, well, your employer doesn't have to provide those things to you anymore, which they had to under the Affordable Care Act.
How do they justify the fact that it will hurt the people that supported them most enthusiastically during the election?
This bill really is in line with what Republicans have been talking about ideologically for more than 8 years. Of course, they've been talking about repeal and replace Obamacare. They were elected on that. I don't think anybody doubted their interest in repealing Obamacare. But they also don't like entitlements. So the cuts to the Medicaid program, which is something that, a lot of supporters in red states benefit from, the Republicans view that as an entitlement, and they feel the program has gotten too big, too expansive. It's government-run health care. There's a lot of waste in the system, and they're trying to bring it back to, people who are disabled or pregnant women or children and not able-bodied adults. That's the Republican ideology behind this.
All right, Shannon Pettypiece. To be continued. A lot of discussion continues. Thanks a lot.